Heart disease is the number one killer of women. 1 in 3 women will die of heart disease. And most women who die suddenly of a heart attack didn't even realize that they had heart disease or had risk factors. So that's why it's important for women to get screened so they can identify their risks and be able to intervene early before they have long-term health outcomes from heart disease. Heart disease is a silent killer because 64% of women who die suddenly of a heart attack didn't have any symptoms. What we usually tell women is know your numbers. Most women walking around don't even realize that they have elevated blood pressure or high cholesterol, and these are things that can greatly increase their risk for developing heart disease. So that's why it's important to get screened to find out, do you have risk factors that could potentially lead to a risk of a heart attack or stroke in the future? And once you identify that, then you have to figure out what do you need to do to decrease that risk. Many of the risk factors are the same in men and women, such as your traditional risk factors like high blood pressure, high cholesterol, diabetes, obesity, smoking, family history. There's some risk factors that are unique to women. Once a woman reaches menopause, her hormones shift. And once there's shift in the hormones, her risk for heart disease increases. And a woman who has had preeclampsia or eclampsia has a double risk of developing heart attack or stroke in the next 5 to 15 years. And there are other conditions and other diseases such as lupus and inflammatory diseases and conditions such as anxiety and depression that are more common in women and greatly increase their risk for developing heart disease. So there are these risk factors that we have to be aware of.